So the last section is looking at imbalances of acid-base balance. Imbalances are classified as either due to failure of the respiratory system and or the metabolic system in maintaining acid-base balance. We are going to start out with what are called simple acid-base disorders, where only one system is not functioning correctly. Respiratory acidosis and alkalosis this is caused by failure of the respiratory system to perform its role in balancing pH. The most important indicator for a respiratory condition is going to be examining blood PCO2, and we're looking at blood arterial gas measurements. For metabolic acidosis and alkalosis, these are caused by abnormal bicarbonate levels, or they'll be indicated by abnormal bicarbonate levels, which indicates that the renal system is not doing its part in acid-base balance. There are 4 disorders for simple acid-base disorders. There is respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. The first thing to look at is look at pH. If it is, okay, so then actually, I guess the first thing really is to know your reference values. The reference value for physiological pH is 7.35 to 7.45. So if pH is less than 7.35, it is some type of acidosis. If it is the blood pH is greater than 7.45, it is some type of alkalosis. So know your reference values, look at pH, and you're going to look at PCO2 and then at bicarbonate levels. And then the second thing to do is look at the partial arterial pressure of CO2. The range for PCO2 in millimeters of mercury is 35 to 45. So if it is outside this range, it could either be the cause or the compensating mechanism, and we will get to the difference between those. And then the third thing to do is look at bicarbonate levels. Bicarbonate levels are measured in something called milliequivalents per liter, and it's 22 to 26. And depending on textbooks, that could vary slightly. I've seen textbooks also record 21 to 27. So your textbook uses 22 to 26, so that's what we are sticking with. So know your reference values. And before you do the exam 3B, I would write them down so that so every time you start an exam, I would have a piece of scratch paper, okay? Because sometimes it's easier to figure things out when you have that piece of paper. And then when you get ready to take 3B at the top, you should write pH is 7.35 to 7.45, CO2 35 to 45, bicarbonate 22 to 26, because you're going to need that information. It's kind of, like, it's just a reference sheet. It's what you're going to need that information to figure out what disorder you're looking for. Okay. So as mentioned, you need to look first at pH. So if pH is less than 7.35, it's acidosis. And if PCO2 is greater than 45 millimeters of mercury, then the cause for acidosis is failure of the respiratory system to maintain acid-base balance. This is usually due to a decrease in ventilation. This can occur in emphysema or pneumonia or of gas exchange. Again, emphysema, pneumonia, cystic fibrosis, because there's a lot of sticky mucus, also affects these. Always remember that CO2 acts as an acid. CO2 acts as an acid. So if you increase CO2, pH decreases and the blood becomes acidotic. If CO2 drops below normal levels, then the pH increases to over 7.45, and that condition is respiratory alkalosis. A cause for respiratory alkalosis, it's usually hyperventilation. CO2 is eliminated faster than it's produced. The blood becomes alkaline, so over 7.45. And oftentimes this is due to stress or pain. So people get pain and they start to hyperventilate and they'll become alkalotic. This is a chart saying exactly what we just went over. For respiratory acidosis, pH is going to be under 7.35. PCO2 is over 45. For respiratory alkalosis, pH is over 7.45 and CO2 is less than 35. For metabolic acidosis, pH, again, is going to be less than 7.35. So that's representing acidosis. And then the metabolic part is if you look at bicarbonate levels. Bicarbonate acts as a base. So in order to get metabolic acidosis, that would be from low bicarbonate. There's low base, allowing the blood to become acidic. Causes can be ingestion of too much alcohol as it converts to acetic acid, also excessive loss of bicarbonate. For metabolic alkalosis, so again, alkalosis is going to be over 7.45. If it's due to metabolic issues, then that's going to be due to a high amount of base, so a high amount of bicarbonate. Causes could be vomiting of the acidic contents of the stomach, or usually this is due to an over-ingestion of antacids. So Uncle Joe, he gets heartburn and he starts popping the Tums all day long. That can result in metabolic alkalosis. So what we just discussed is called a simple acid-base disorder uncompensated, meaning and this uncompensated usually occurs when it's acute. So I step on, a nail, I start to hyperventilate, and then my CO2 levels go low and I'm in respiratory alkalosis. I recover and that condition recovers quickly. Okay. When we get into longer term conditions, because there's a digestive disorder or something like pneumonia or emphysema, so a chronic condition, then if it's respiratory alkalosis or acidosis, the renal system will try and compensate. So the one that's not broken will try and compensate. If one system fails, the other system tries to compensate. Renal system will work harder to maintain pH if the respiratory system fails. The respiratory system will work harder if the renal system fails. One of the things to remember is that the respiratory system cannot compensate for respiratory acidosis or alkalosis because that's the system that's broken. And then renal system cannot compensate for metabolic acidosis or alkalosis because that's the system that's broken. So you have to rely on the working system for compensation. So respiratory compensation occurs in metabolic acidosis and in metabolic alkalosis. So remember, CO2 acts as an acid. So if the body is already in acidosis, it needs to decrease the level of CO2. And that will decrease the amount of acid coming from CO2 to try and compensate. So the respiratory system tries to decrease the level of CO2 by increasing the rate and depth of breathing. In metabolic alkalosis, because CO2 acts as an acid, we want to try and increase CO2. And to increase the CO2, the respiratory system will do this by decreasing breathing through slow, shallow breathing to allow CO2 to accumulate. For renal compensation, bicarbonate is a base. So the kidneys will try to compensate for pH problems by adjusting bicarbonate levels. In respiratory acidosis, you want to, it's acidic, you need the blood to become more basic. So you want to increase bicarbonate. And the kidneys will do this by reabsorbing and creating new bicarbonate and secreting more hydrogen ions. These three pathways are in 25.5 with 3 diagrams, and they're one of the things that I would recommend that you review. In respiratory alkalosis, the blood is already too basic, so you need to decrease the bicarbonate in order to remove base from the blood. So the kidneys will excrete more bicarbonate. They won't reabsorb it, they allow it to pass for excretion. So we have simple acid-base disorders that are uncompensated usually due to something that's acute, and then it comes back under control. And in uncompensated, you will have one value that is normal for like either CO2 or bicarbonate will be normal, and then one will not be normal. So I think that this lecture really comes together as we work through these patients. So the first thing to do is look at pH. For patient A, the pH is 7.2. So is this individual, and is it acidosis or alkalosis? Very good. Okay. Whoops. Acidosis. Okay. So that's the first thing you do is you look at pH and you write acidosis or alkalosis. Then you go to PCO2 and bicarbonate. Don't just stop at one, just to always double check. And you look and you go, is CO2, is this high, normal, or low? Very good. Okay. And then we go to bicarbonate. Is bicarbonate high, normal, or low? It is normal. So in a simple one, that's uncompensated, we're just going to have one that's off. And so I'm just going to put N for normal. I usually put a check if I'm doing this by hand, but for now I'll put normal. So then the diagnosis is either respiratory acidosis or metabolic acidosis. So which one is it? Which one is not normal? Very good. So then you finish the diagnosis with respiratory. So this is respiratory acidosis. So then we're going to go to the next one. 7.7 is okay, so we're just going to start with alkalosis. PaCO2 is high, normal, or low. Bicarbonate is high, normal, or low. And so, as you said, it is metabolic acidosis. Okay. Then we go to C, and is this acidosis or alkalosis? Very good. And then is PCO2 high, normal, or low? And bicarbonate, high, normal, or low? So this is which one? Yep. Respiratory alkalosis. Then we go to our last one, is we have alkalosis or acidosis. pH is 7.3, so we have and then CO2 is high, normal, or low. And bicarbonate is high, normal, or low. So we have metabolic or respiratory. Very good. Okay. You will have 2 questions. There's 3 questions actually from today. 2 look eerily similar to what we're doing. One from this slide, and then one from the next slide. Clear those. Okay. So this is simple acid base compensated. And it gets a little bit more complicated, but it starts the same way with 7.29 is acidosis or alkalosis. Very good, acidosis. Now is CO2, is it high, low, or normal? It is low. Now, if you look at bicarbonate, is it high, low, or normal? It's also low. Very good. Okay. So in a compensated disorder, you'll get both values out of range. So it's not as straightforward as before. You go, which one's off? Like, okay, is it whichever one was off was the reason why pH was off. This one, you have a primary cause and then a compensating mechanism. So with acidosis, which one of these would result in acidosis? Low bicarb or low CO2? That's right, bicarbonate. So then we call it metabolic acidosis with respiratory compensation. Okay. So there is compensation, it's trying. So the pH would actually be worse if the CO2 was normal. So it'd be like 7.23. Okay. So then let's go to the next one where we have 7.6. So this is alkalosis. So always start there. And then you look at, is CO2 high or low or normal? And then with bicarbonate, is it high, low, or normal? Also, so it's 22 to 26 is normal, so it's going to be high. So when we have compensation, we're going to have two abnormal values. One is the primary and one is the compensation. So which one of these causes alkalosis? High CO2 or high bicarb? Yep. So bicarb acts as a base. So high bicarbonate will give you metabolic alkalosis. And then we have with respiratory compensation. So we will continue with two more examples. 7.55 is acidosis or alkalosis. Always start there. Your answers get down to 50-50. Then we have CO2 of 28 is high, low, or normal. And then we have a bicarb of 18 is high, low, or normal. And this one, would a low CO2 or a low bicarb cause alkalosis? Yep. So that's respiratory alkalosis with renal compensation. And moving on to the last one, 7.3 is acidosis or alkalosis. Yep. And then 50 is high or low. $30 is high or low. And which one would we expect to be the primary cause of acidosis? High CO2 or high bicarbonate? Yep. So the primary cause is respiratory acidosis, and then we have with renal compensation. So I will be posting this lecture probably later today, just so it's up there for everyone. I know it's a short little one, right? But like you will see, there's one general question, and I can't remember if it's like what causes respiratory alkalosis or what results, but it's a little bit more general. And then there's one example when you'll have a patient with a compensated disorder, but it will tell you it's a compensated disorder. And then you'll have one patient that has and uncompensated. And in the question, it does tell you that it is a simple acid base uncompensated. So those are, you'll see these again. This is also what you do in lab this week. So I like it when they overlap. But that is all for new material for exam 3.